Hello and welcome. My name is Dr. Rizwan Qureshi. I'm one of the consultants working in emergency medicine in Sydney, Australia. And lately, lots of IMGs have been contacting me. They've been getting shortlisted for job interviews. And out of many questions that they get asked, one particular question particularly bothers them. And that's a question about if you ever made a mistake or if there's ever been a complaint against you and what did you learn from it. And nobody would like to share their mistake, especially during job interview. And we'll come to the uh, aspect of the question and how to address and how to answer this question a bit later. But I'd like to share a very interesting and very humorous incident which happened to me when I was a surgical intern back in 2002. I was in surgical ward 5, which was headed by Professor Abdullah. Associate professor was Dr. Shafiqur Rahman and Dr. Tabinder Sultan, who are registrar. During one of the OPD session, I came across this 60-year-old gentleman who had very obvious clinical jaundice and also had an abdominal pain and had a palpable right upper quadrant mass. And Dr. Shafiqur Rahman said to me that, look, this is a very interesting patient. We'll investigate him, we'll work him up, and we'll operate on him. Rizwan, go and put this patient in one of your allocated beds and look after him well. So I felt very honored that he's given me this responsibility, and I used to take all these patients very seriously. And this patient in particular was a huge attention from all the interns and the residents and even the registrar about this patient, what might be going on. I remember some of the pre-operative ward rounds, Dr. Shafiqur Rahman would ask us, what is the Courvoisier's law and how would you investigate that? And one of the investigations that we did for this patient was percutaneous transhepatic cholangiopancreatogram. And that was the first time I'd seen that investigation. And came the operation day. Dr. Shafiqur Rahman operated on this patient. Dr. Tabinder Sultan was, one of the assistant during this operation. And I was the intern who was holding the retractor. When the gallbladder came out, it did look that it is quite big and inflamed. And we put the gallbladder in the formalin and was handed over to one of the OT technician and asked the OT technician, can you please hand this gallbladder to the relatives who are outside the theater, and ask them to submit the specimen to the pathology lab. And they said that no problem, we'll get it done. During one of the ward rounds, nearly after about 7 or 10 days, Dr. Shafiqur Rahman, during the whole of that ward round in which there were many surgical doctors and interns and residents and other associate and assistant professor, asked me what happened to the report. Did it ever come back, the pathology report on this patient, gallbladder specimen? And I said, yes, it should have come back by now, but I'm not sure why it's not still back. And he asked one of the relatives who was sitting there that, did you submit the gallbladder to the pathology lab? And he said, no, we didn't. We thought it was a waste, so we dumped it in the rubbish. And Dr. Shafiqur Rahman just completely lost it, and he became so angry and he was very disappointed and said, Rizwan, it was your responsibility to personally submit this gallbladder to the pathology lab. It got misplaced. Now we'll never know what's wrong with the patient. And if it's a cancer, whole of his treatment was based on the pathology. And I felt so bad and careless, and I just felt very unprofessional. And I was very disappointed with myself. And at that point, it also occurred to me that once you become a doctor, it's your responsibility to deal with any hiccups when it comes to patient management. It's nobody else to blame. But I also felt a bit targeted because, I wouldn't say the word targeted, but I felt bad from the point of view that, I was scrubbed during that procedure and I was not able to physically hand over the specimen to the pathology lab. So anyway, Dr. Tabinda sensed that I felt quite humiliated, and she came to cheer me up. And during that, conversation, she asked one of the relatives who was there that, where did you put the sample? And they said, oh, we dumped it in the rubbish dump outside the OT. She said, go and get it from there where you dumped it and go and look for it. And I said to Dr. Tabinda, it's been nearly, 7-10 days almost. How do you expect to get the sample back at this time? She said, doesn't matter, let them go and look for it. And they went and looking for a sample. After about half an hour to 40 minutes, Dr. Tabinda came, screaming almost in the ward that, oh, Rizwan, they found a sample. And I could not believe my ears. The sample was perfectly preserved in that formalin. I don't know, it was the formalin smell, or maybe the sample got, hidden or buried somewhere in that rubbish dump. Now, this is in Civil Hospital Karachi, where there are lots of stray cats and dogs roaming around. but somehow that sample was retrieved. I personally submitted that sample to the pathology lab, and unfortunately for the patient, it was the adenocarcinoma of the gallbladder. And it it just goes on showing that, as I was saying before, that you are responsible for your patient. Your patient care suffers, it is the responsibility of the doctor first and foremost. But it also made me realize the value and importance of delegation, that when you're handing over a task to someone, make sure that you hand over a task to someone who's equally responsible, like your intern or resident or even a registrar, because you're scrubbed in that. And also the value of closed loop communication. If this gallbladder was to go to the pathology lab, I would have asked that intern or that resident or whoever is submitting the sample to go into the pathology lab, submit the sample, and report it back to me that you have done that and this is the receipt that they've obtained. So in that way, such a crucial task is not missed, and there's a closed loop of communication, accountability measures in place. At one of my interviews, fast forward several years later, I was doing this registrar interview, and this question got asked to me, that Dr. Rizwan, we're going to ask you a question about if any mistake that you've done or any complaint that has been made against you, and what did you learn from it? And at that very point, this example came to my mind, and I narrated that example, and it just amused the entire interview panel. I got that job, so I think they were impressed, but I think I also sensed that they were like, what a medical system, like what goes on in there. One thing which I'd like to highlight, that whenever you get asked this question, it is very important not to narrate the entire story. It is important to give the aspects of the story, that in particular this case, that there was a case in which I was involved, or I was responsible for submitting a gallbladder to the pathology lab. Unfortunately, I was scrubbed and the sample got lost in that process. Fortunately for the patient, the sample somehow got retrieved, and what I learned from this mistake, that it is my responsibility, my patient, if he or she suffers any adverse outcome, it's my responsibility. The second thing that I learned is the value of delegation, that I should delegate or hand over the task to the doctors who are responsible, and ensure that there's a closed loop communication, that if they're doing a task, then they should report it back to me, making sure that that task is completed. And this is the concept of closed loop communication is frequently repeated in emergency resuscitation or crucial and critical emergency cases. So this is one of those examples which still amuses me to the day, and I still give this example to junior doctors who are coming to the workshops, that this small example gave us so many valuable lessons. So all of the doctors who are getting shortlisted, best of luck. If you go to our website emergencyfocus.net, you can enroll to a medical career guidance course, in which there's how to make your medical application, how to fill in a medical application forms, in particular how to work out your CVs, and how to deal with these kind of interview questions. And it's a video course, so you can enroll and you get an immediate access. So please do enroll in that course. All the best for your interviews. Hope you all get a job and work as very generous and very responsible colleagues. All the best. Thank you very much.